Hi, and welcome to this part 2 video on what it's like to not be autistic. This is from a neurotypical perspective, i.e. myself. So for some background, I encourage you to watch the part 1, which has all the context as to why this video is being made, why it might be useful, some disclaimers, and really some limitations of what it is that I'm doing, because again, it's just a representative sample of one. What I have loved is reading the comments on the first video, which have been overwhelmingly positive, and lots of people asking for me to continue this series. So this is exactly what I'm going to be doing in this video. I'm going to be looking at some of the questions that have been put to me by autistic people to try and gain an understanding of what life is like from the neurotypical point of view, as best as I can explain it in my own way. So thank you so much for all the positivity to the first video. It's been absolutely fantastic. I've thoroughly enjoyed reading and replying to as many comments as possible. Keep them coming. Please continue to put your comments in the section at the end of this video. And again, if this is working out okay, I'll continue to make it, because I had a lot of questions and it's going to take me a while to get through these. So I'll do my best. I'll jump straight in then. So the next question that was posed to me by one of the subscribers on the channel was this: what is sensory overload like for neurotypical people? I know that everyone can get overloaded, but I imagine the experience and aftermath is somewhat different. Now, I think that's a fascinating question because it's starting from the premise that there is sensory overload. Now, I think for neurotypical people, i.e. people like myself, that sensory overload really comes into its own when it's about things like pain. So, for example, being at the dentist would be a sensory overload that it's just too painful or too scary. So these are very kind of emotional reactions to what would be a sensory overload. If we're thinking about input that's coming into the system along the lines of, say, sound and colour or activity that's going on in front of us, not so much actually. The sensory overload is something that's actually enjoyed. So like people like myself, and again, I'm not speaking for every person who's not autistic, I'm just speaking for me and obviously my friends and people I spend a lot of time with, that actually we enjoy what might be considered as sensory overload. So let's say going to a sports or a concert or something where there's maelstrom, where there's people shouting, there's laughter, there's colours, it's vibrancy, it's just like an absolute kaleidoscope of sound and texture and colour and movement and flavour and all of these things in the same place, and we actually thrive on it. We go towards that and immerse ourselves in sensory overload. So we'll go to places where there might be sort of museum exhibits doing art installations where there's like a crazy amount of sound and light being thrown at us. And we're sitting there with great big smiles on our faces, loving every minute of it because it doesn't hurt. You know, we can't, let's say if you've got a headache, bright light is going to hurt. So again, that's a pain thing. And we'd shy away from that and we try and down all the lights and, you know, close the curtains and make it all dark. If we've got a headache, we might not want really loud sounds, and sometimes sound can get really painful. Or like if you're at a concert and the bass drum is sort of thumping against your chest in the huge sound system, you might find that a bit uncomfortable, but you just got to deal with it and move on. So a sense of sensory overload is something that I personally would go and seek. I like putting myself in environments where there's a load of things going on, a load of sort of information being thrown at me, because I have this filtration system that just makes it okay. It's like all of that stuff goes through my senses, whether it's my nostrils, whether it's my ears, my eyes, my textual touch, and I just assimilate everything, and it sort of goes into the right places and it's sort of filed somewhere in my head and in my body that makes it really comfortable, and I'd probably get a dopamine response from it, and it's something that I thrive on. And I'll walk away from a highly intensive sensory environment with my heart beating and a sense that I've thoroughly enjoyed myself and I've had a wonderful experience, and I then put that in the category of great stuff in my memory system, and I would want to go back to it. And it's something that if I felt I needed to repeat, I just go back. So I like going to sports stadiums, I like going to concerts and having loads of stuff around me, but not always. And it's a mood dependent thing. There's been times when I've been to concerts where I've or shows, and I've been like in the standing section, and I've got a bit uncomfortable because people are hustling and bustling me and bumping into me or jumping, and I don't like that. But at other times, I'll throw myself into the mosh pit in a death metal concert and I'll have the best time of my entire life. Not just when I was a kid, like 17, 18, 19, but in the last couple of years. I went to a heavy metal festival in the Czech Republic with friends, and we were moshing down at the front, and I was getting bumped and beat up and bruised, and my hat was falling off and was falling over and being picked up. There was dust, sound, light, noise, music. And I absolutely loved every minute of it. But then on another day, if I just wasn't in the mood for that sort of stuff, I'd want to stand at the back with my beer and just sort of watch the music from a distance. So we're really good at being able to take on sensory information, deal with it, and just sort of magically manifest it being okay. What we don't like is when it starts hurting. Now, I've just realised that the light's really bright, so I'm going to close the blinds for a second. Not because it's bothering me, but because it probably looks really weird on the video. There we go. So instantly a change of light, because I'm aware that my face is suddenly looking really bleached. But the light coming through the blinds wasn't bothering me in the slightest. It just got really bright. But again, like my magic filters just managed it. It didn't hit any sort of threshold of being a problem. And that can be the same for texture. We thrive on different textures, different tastes. We want to go and have the super hot curry at times because it's kind of like a really bizarre, painful sort of feeling, but it's wonderful sensory. We're not so great with bland type foods, but at the same time, if we've got stomachache, that might be exactly what we want. So that sense that we can cope and we can manage. And the other part of that question about the aftermath is that we generally look back on those sort of situations as being enjoyable and things to want to repeat. And if we've taken this on from a very young age, so if we've been put in environments as a child where there's been lots of stimulating stuff going on around us, then it becomes our normal, it becomes our everyday, and it becomes something that we actually, we go and seek to spend time in those kind of environments. So I don't know if that sounds odd or not, but it's like we're just made to be able to take all this stuff in. You can almost throw an infinite amount of stuff at somebody like me, and as long as I'm in the right mood for it, I'm absolutely great. So one day I might like it, one day I might not, but I'm kind of kitted out to deal with it and be completely okay with it, so I don't get stressed out or feel overwhelmed in any way unless I've got a secondary thing going on like stomachache or headache or something like that. So I hope that's kind of answered that question about what that sensory overload feels like. It certainly doesn't not feel like an overload. It feels like a generally positive experience. Okay, so I'm going to move on to the second question, and that's probably all I've got time for in this video, but it's a really good question. So here it is. What happens when you communicate? Like, how stressfully precise does it feel like your word choices need to be? Can you struggle to condense a thought? Do you feel like you've been clear enough without having to be infinitely specific? Now again, a wonderful question, because I can feel what's going on behind that question, in the sense of, well, the person who's written that question clearly does feel like they struggle to condense thoughts, that their words have to be super specific. Everything has to be analysed and detailed, and then there's no sense about whether it's actually hit home correctly. That's my take on that question. And for me, I guess I'm going to be giving a similar answer really, which is I actually find this stuff really simple. I mean, surprise, surprise, I'm a clinical psychologist. My job is about listening and talking and asking questions and assimilating information. But I don't really think about my thoughts. Like this question, none of this is scripted. I've just picked these questions up, I've opened the camera, I've started recording, and I'm talking. It's like there's this free-flowing information from my brain, like somewhere in my brain, all of this is being worked out, and it's just arriving from my mouth and projecting out to be heard in this space that you're listening in. So none of it is actually causing any difficulty as such. It feels very, very genuine. It feels very calm. It feels very organized, like it's already being done. There's this sort of synchronicity between my brain and the words that are forming in my mind, my imaginative thoughts that are being used to demonstrate what these words are. I'm not actually having to put much thought into the words. I hope that the right words are coming out. Now, I can get clumsy and I can say the wrong things and I can make a mistake and go, no, that's not really what I meant. Or I get tongue-tied, which means that we kind of struggle to form the word that we're trying to think of, and we get a bit confused, and we just get a bit, I can't quite, that it's on, you get a bit like that. And that rarely happens, but when it does happen, you just kind of shrug your shoulders and go, yeah, I'm not having a good day with my words, am I? And that's fine. And if we're anxious, or if we're tense, or if we're distracted, or if we're in pain, any of those kind of emotional contexts, then the words really start making a bit of a mess, or we make a hash of it. Now, we can have all sorts of difficulties forming words in specific circumstances. So let's say you've got to do a job interview, or you're asking someone out on a first date, and there's a real pressure to get it right. We can overly worry and overly analyze, and perhaps sort of practice our script in the background a little bit, and then try and deliver it. But it always comes across as stilted and a bit not quite flowing properly. So we don't really do that stuff very often. I certainly don't. The majority of time, I'd say probably 99% of my speech, my communication verbally, is just free flowing off the top of my head. Stuff just randomly just wanders into my voice, out of my mouth, and out into the world. And I'm generally pretty happy with that stuff. I use non-verbal kind of cue associations to work out whether it's landing or not. So when I'm talking to the camera now, I've got no idea really whether anyone's getting it. I have to wait until the comment section and read it. If I was doing this in real life, if I was teaching, or if I was talking to somebody, I would intuitively know from the way that they looked and their non-verbal cues whether they were getting it or not. And if I felt that the words that I was saying were not really being understood, I'd see it in the other person. They wouldn't have to tell me they don't understand. I would just see that they didn't understand. And then I could follow it up with some questions along the lines of, is what I'm saying making any sense? Is this kind of coming across okay? And I know when I've been teaching that sometimes what I've been saying hasn't been well understood, and I'll just backtrack. I'll say, I can see this is kind of landing poorly. I'm not making a good shout at describing these things very well. So I'll backtrack, I'll start again, and I'll describe things in a different way. And usually then you start seeing the nods and the penny dropping kind of moment. And then people sort of like get into it and they understand. And I can ask very direct questions. Do you get this? Is this okay? Am I just saying it in a weird way? And then I get into that conversation with someone, and I can change around as necessary. So I certainly don't have to be infinitely specific. I do waffle on a lot, and I'm good at talking, so that's kind of one of my key skills. Sometimes knowing when to stop is key, but obviously it's different talking to a camera because I don't really know when to stop. If I'm talking to another person, I get all the non-verbal cues. I've got all this verbal kind of like the toing and froing. I absolutely know when I've said enough. It's an intuitive thing, it's built in. I don't really have to put too much thought into it. If I get a sense that something's going a bit wrong, I'll ask, is anything going wrong? And if there is, then I'll change it around. So that sense of condensing a thought, I don't really have to condense the thought arrives for me. So I see myself as being in partnership with my own brain. There's different sections of the brain that are responsible for formation of words, formation of thoughts, and the clarity with which those words are then expressed. And I just leave that all to it. I have this implicit trust that my brain has got me, it's going to look after me, it's going to put me in good shape because I'm over 50 years of speaking and it's doing a pretty good job of it so far. I do make hash-ups and make mistakes, and I just apologize and I move on. But again, pretty 99% of the time, my brain is doing all the work for me, and I just have to sit out here and let everything flow through. And I actually enjoy the process. It's not stressful, it's not painful, it doesn't feel difficult, it feels natural, it feels easy, and it feels like a flow. So it's like the calmest river that you can imagine, and you're just sitting on it on a canoe or on a rowing boat, and it's just gently taking you to exactly where you want it to be with minimal effort. And that's what most of it is like. Outside of job interviews and asking people out and stressful stuff like that, it all feels really easy and a sort of a gentle process. So I'm going to finish it there. And to summarize the two questions, both of them are coming from a place where there clearly are problems. So within the sort of the autistic person, people that have asked those questions, they're clearly identifying problems for them, asking me what it's like for me. I'm not saying I'm doing it better or worse than them. What I'm saying is, from the neurotypical perspective, the way that we're designed, the way that we're built, and the experiences and the practice that we've built for many, many years, this stuff is actually easy. It's like built in. It doesn't seem difficult unless something odd is going on. And then we can kind of change our strategy a little bit. For the most part, all of these things about communication, about filtration of information that's coming through, about the way we organize thoughts and the way we speak is very comfortable and is very easy. Lots of people with social anxiety will struggle with some of these things. Lots of people with light sort of like sensitivities will struggle with some of those other things, but those aren't the norm, if you like. The way that we're built is to be fine with a ton of sensory overload and to be able to communicate and send all our thoughts out. We've had years of practice, we get pretty good at it. It doesn't mean what we say is any good. People can say terrible and really odd and strange and incorrect things, but the way that their thoughts and the way that words coming out is a free flow nevertheless. So again, I hope this has been a useful video. I'm really happy to keep putting some of these together. It seems like they're really useful. I'm thoroughly enjoying doing this. Please keep the questions coming, and please put your comments in at the end of the video and let me know what you think of these things, because those comments are fantastic to read, and I think they're also helping lots and lots of people who are also not autistic understand the sort of the autistic perception from looking at these comments. So again, please like, subscribe. We'll be putting lots more content out about this and about all other things on the channel. So thank you very much for watching this video and listening to me meandering through my thought process. And I'll see you in the next video. And until then, please do take great care.